A new study making the internet rounds has found a possible link between cannabis and COVID-19 prevention. While cannabis is still illegal in most parts of the world and remains a controversial topic, cannabis compounds have been used in medical research for many years. Now scientists from Oregon State University and Oregon Health and Science University, both in the United States, state that the plant can be used as a tool for COVID-19 prevention. Dr. Ruth Muchiri, who co-authored this study, spoke to Arise News on these findings.
We found that the CBGA and CBDA, that is the acid forms of the CBD as well as CBG, were the most active both in the screening work as well as the live cells assays. And THCA was also active in our screening, but we could not proceed with the live cell assays because we did not have enough of it, due of course to legal reasons. We could not obtain enough quantities of the THCA.
Now, your study makes it clear that smoking cannabis is not necessarily the solution, but consuming in other ways such as through a pill to really get the most out of these active compounds that you say have an effect on COVID-19. Can you explain more on this?
When you smoke cannabis, or pot as most people call it, what you do is you break down the acids to the non-acid forms. The acid form, that is CBDA, CBGA, THCA, and others, are not stable in high temperatures. So if you take this in smoking or vaping, you're not going to get the effect that we saw in our study. And that's why you have to take the raw form, that is CBDA as well as CBGA.
So to be clear here, we are not necessarily talking about the psychoactive compounds in cannabis having the ability to prevent COVID-19. Because going by the headlines, there could be people out there who may think that they can prevent COVID-19 by smoking weed.
Absolutely not. That will not work. The psychoactive compound is THCA. That is THC, sorry. And that was not active in our assay. If you look at our paper, we had a list of all the compounds that we tested, and THC was one of them, and it was among the bottom, least effective actually. So that is not going to work.
And Dr. Mochiri, from reading your study, I do understand that you are not advocating for these compounds found in cannabis to act as a sole preventer of COVID-19, but rather to lend a helping hand to vaccination drives.
The reason we are doing that, or we are advocating for that, is because the compounds we studied would be most effective if you find out you've just been exposed to the virus. Maybe you had a party and your friends are sick. If you take it, these compounds right or immediately, you may have a higher chance of preventing the virus from attacking the cells. But if you had vaccine to begin with, the breakthrough infection will be harder compared to if you're not vaccinated. So the fact that you have the vaccine in your system, so you have antibodies that are ready to fight any form of infection. And on top of that, you have compounds that are going to inhibit the entry of the virus into the human cells. Then you have double protection. And that's what we are advocating for. And these compounds are readily available, so you can go quickly grab them from the stores in cases where they are legally allowed.
And speaking of legalities, with cannabis still illegal in many parts of the world, including Nigeria, where I am, how far do you realistically see this study going, and what barriers does this also create for your research?
First of all, the barrier here is the fact that it's illegal in most countries, and even in US. We're hoping that this momentum that has been created so far is going to push the authorities to acknowledge that there are so many benefits of hemp extracts. And when I'm talking about hemp, this is a plant that has less of the psychoactive compound THC. So it is less than 0.3%. And that is considered legal to study, except that compounds like THCA can be broken down to THC, and that's why it is still illegal. And I'm hoping this is going to to start. Where I am, we already know Canada is the hemp studies and compounds are legalized. You can do as much study as possible, but other countries are still lagging behind. So we hope that this momentum is going to open ways for the authorities to acknowledge that there's positive in studying these compounds.
And have you received any funding and support for your research so far? And what sort of support do you also need to build on these developments?
So far, we did not receive any grants, and we actually wrote grant proposals for this work. But the pushback was there was no previous known studies that supported what we were proposing, and of course, because it was new studies, so we were not given any grants, and we kind of had to squeeze in funds from other projects to actually fund what we did in the lab. And right now, we still do not have funding to move forward, and that's what we're trying to advocate for, writing grant proposals, showing that there's promise and we can proceed to the clinical trials with these compounds that we have discovered. So there's hope, but so far we have not received any funds.
And looking forward, what are you hoping for these findings to achieve?
So two things. The first one, we are hoping that we will proceed with the clinical trials with these compounds, and that we're going to get the donors or the government on board to actually start us off. And secondly, we also want to join hands with the growers, the farmers who can supply these compounds in a way not dwelling on profit margins per se, but a way to help fight this pandemic, because that is our goal, to fight this pandemic any way possible. So that is my my hope moving forward. First, clinical trials, so we can move on, and then work with the stakeholders to make this a reality and have these compounds available probably in the near future to the population.
Dr. Ruth Muchiri, many thanks for speaking to us on Arise News.
Oh, thank you for having me. I appreciate it.